over measles as Oregon reports the largest in-state outbreak in 3 decades. Officials in Oregon say 2 people have been hospitalized and all those infected were unvaccinated. But back in 2000, the CDC declared measles eliminated here in the U.S., even though outbreaks and cases still pop up every year. Now, the CDC says nearly 1/3 of measles cases since the COVID pandemic have occurred in the past 3 months. Let's bring in NBC News medical contributor Dr. Vin Gupta to talk more about this outbreak. So, doctor, why has there been an uptick in measles cases, especially when it comes to younger populations?
Well, Valerie, in the lead up, you said it, which is that unfortunately we're seeing these cases amongst unvaccinated children. We've seen the rate of medical exemption in kindergartners, places like Oregon, jump from, say, 1% just about a decade ago to now almost 10%. That's the explanation, unfortunately. Very contagious virus. And unfortunately, what we're seeing here is there's a lot of medical exemptions, a lot of unprotected children.
And how important is it for infants and babies to be vaccinated against measles? Is this something that the doctor's office offers when kids are getting their recommended vaccinations?
Yes, absolutely. My wife's a pediatrician. You know, we always talk about the vaccine schedule for children that's heavily recommended by the CDC and others. Measles, mumps, and rubella for all the parents out there of young kiddos. You'll remember, this is something that's part of a routine vaccine schedule for your child. It's a 2-dose vaccine regimen. It's something that we highly, highly recommend. And it's something that's required in many parts of the country, especially if you want to send your kids to school. And so this is, and the reason, to answer your question, what we've seen is that unprotected children are at very high risk of getting hospitalized and in some cases even dying. We also see that with pregnant women that are unvaccinated or those that are medically higher risk. So if you're medically higher risk and unvaccinated, measles poses a serious threat to your health.
Let's say you are an adult who was vaccinated as a young child. Should you be looking to get a booster to protect yourself? What if you live in Oregon where we're seeing this outbreak?
Well, so there's a few things. I'm glad you brought that up. If you're born before 1957, if you know that you've had 2 doses of the vaccine before, if you've had prior measles, or if you've had, say, Valerie, titers confirming immunity, you are good. You do not need to get an additional booster shot. If you only received 1 dose of the vaccine, or if you don't know your status, if you're pregnant, unvaccinated, and exposed, you should immediately go speak to your medical provider, especially in that last category, because there are certain medications we can give in those specific unique instances.
And what should we be on the lookout for in terms of symptoms to protect ourselves and get ahead of the measles?
Well, you know, what's interesting with measles is that you can get exposed, actually be infected, and be contagious before developing symptoms for up to 4 days. The symptom profile, there's a rash that is characteristic, full body rash ultimately, and flu-like symptoms. So in some cases, it's non-specific flu-like symptoms, high fever, but there is a characteristic rash that if people just search on the internet, they'll be able to see and identify what that rash looks like. But again, the piece with measles, what's really difficult in terms of controlling it is if you're unvaccinated or if there's a population that's unvaccinated, everybody is likely to get it, because it's so contagious. So that's really the important thing to remember. If you're unvaccinated, you know there's an exposure in, say, your school district, make sure you get protected.
All right, Dr. Vin Gupta, thank you for your reporting. We appreciate you.